God bless you. Okay, everyone, I just want to wish us all a good afternoon. It is my privilege to welcome you all to the Assembly Chamber for the 2025 Disabled People's Parliament. I want to begin by recognising the significance of this moment, and today this chamber belongs to you all. Deaf and disabled people from right across the north who bring experience, bring expertise and insight that we all need to shape better policy, better understanding and ultimately better outcomes for the communities that we all serve. This Parliament has been co-designed with the organisations representing a wide range of disabilities alongside individuals who have generously shared their lived experience throughout the planning process. I want to extend a sincere thanks to the members of the consultative panel and to every group and organisation involved. Your work has ensured that today's discussions are rooted in the realities people face every single day, whether around health, housing, education, employment, transport, independent living, care and responsibilities, social security, or the persistent challenge of social isolation. Those issues, identified through a public survey of more than 1,000 people, form the framework of our business this afternoon. And behind every item on the order paper, as you know, is a real story, a real barrier, a real impact on someone's life. And today, those impacts are being brought directly into this chamber where they deserve to be heard. The motion before us affirms a simple but powerful truth, that laws and policies work best when shaped by those who live with their consequences. Deaf and disabled people should not have to fight for a say in decisions that affect their independence, their health, their income, their education, or their safety. Yet, so often, those barriers are created when decisions are made without those voices at the table. So today is about changing that. It's about ensuring meaningful involvement and about strengthening communication across departments that so unintended consequences are understood, anticipated and avoided. So I want to formally welcome the participation of the Minister for Health today, the Minister for Communities this afternoon. Minister, your presence and your willingness to respond directly to the issues raised is deeply appreciated by all. It sends an important signal about listening, about partnership, and about a shared commitment to improving the lives of deaf and disabled people right across Northern Ireland. Most importantly, to all of you participating today, thank you for your courage, for your honesty and your leadership. Your contributions will help shape thinking, not just in this chamber, but across public services and policy design and political life here. And as chair of today's proceedings, I'm here to support you, to ensure that your voices and your views are heard with the respect that they deserve, and also to help create the conditions for meaningful and constructive debate. So I won't be putting anybody out. I hope this Parliament challenges us. I hope it motivates us and strengthens our resolve to remove the barriers that restrict opportunity and equality. Your experience is expertise, and today it stands at the centre of the democratic decision-making, exactly where it needs to be. So before we move to the formal proceedings, I would like to invite Amanda Paul to speak on behalf of the consultative panel and to briefly set out the background to this appointment. this Parliament. Amanda.
Thank you, Madam Principal Deputy Speaker. On behalf of our organising panel, I would like to extend a warm welcome to all present today. I would particularly acknowledge our two ministers, Mr Michael Nesbitt, Minister for Health, and Mr Gordon Lyons, Minister for the Department of Communities, who have joined us to engage with our speakers. It is important to highlight that the disabled community involves every department within our executive. It is disappointing, therefore, that out of 8 departments plus the executive, only 2 ministers are in attendance today. Recent government statistics indicate that 1 in 4 people in Northern Ireland live with some form of disability. I watch often BBC Parliament, and on many occasions and on very important matters, only a handful of our politicians are in attendance. I'm aware it is not all that they do, but surely being here today at this important event to support us, in my opinion, should be a high priority. To those who are not here, who have not taken the time to lend us their support, shame on you. But this will not be your only opportunity. Let's improve this next time round. For those that are here, it is our sincere hope that you will not just listen to our speakers, but really hear them and truly reflect on their contributions. If you really hear our voice, this should result in meaningful actions and measurable improvements for disabled people. Under the previous executive, I, including other disabled individuals within this chamber, dedicated approximately 2 years to developing a disability strategy. The strategy was weeks away from public consultation when, regrettably, guess what? Our executive collapsed. I know there is work going on within the strategy, the UN Convention and the Equality Act, but we need to stop kicking things down the road. Some of my colleagues have been working on this for the last 30 years. It is now time to get these things moving. We know in this climate everything cannot happen at once, but these policies give us a framework to work on. I would like to thank the Department for Communities for listening, but why is everything taking so long? Let's get true co-designed documents both published and actioned. At this time, our reliance is on legislation that is 3 decades old and well outdated. This is just not good enough. The implementation of this updated strategy is now necessary and urgently required. Another matter I would like to speak on briefly is the urgent need for the Independent Living Fund to be opened. We've been told time and time again there is no budget, but surely, given that this relates to our most disabled in society, it should be given a much higher priority. This would benefit the recipients, their families, and the communities they live in. Restoring ILF would enable recipients to fully engage in community life and have control and independence each and every day. In Scotland, the government, despite some major budget constraints, still made the decision to reopen the Independent Living Fund in 2024. I would like to congratulate the campaigners who managed to make their voice heard and their government who really listened. Despite this, disabled people in Northern Ireland remain at a disadvantage to those in Scotland. There are many positive stories being heard from the reopening of their fund. Surely, when all the evidence is weighed up, our executive cannot fail but to support us in the reopening of the fund here. After all, this fund helps those with the most complex needs. We would urge the Minister to do the right thing and reopen ILF in Northern Ireland. To summarise, Northern Ireland needs a strong, co-designed disability strategy that disabled people can fully support. This needs continuity from the good work that went before and a renewed effort to produce results. Circumstances will not change for disabled people until our government gives proper priority to all citizens, including those with disabilities. This will take hard work, and even a bit of humility. But we need to set in place a positive future for our disabled community. Of course, funding will be needed to open ILF. Here in Northern Ireland, can we not see the bigger picture? This relatively small ask in budget compared to many other projects would make such a marked difference. I urge the Minister once again to do the right thing and make the necessary decision to allow us to live full and independent life. This is our challenge to you today. Please listen to all those who will speak after me and really hear what they are saying. Thank you.
Thank you very much, Amanda. That sets the context. So I would like formally now to call on the clerk to read the motion.
That this Parliament affirms that laws and policies are most effective when informed by the lived experience of those they affect, recognises that deaf and disabled people seek to enjoy only the same freedoms and opportunities as all citizens, and that barriers are too often created when decisions are taken without their involvement. Believes that the issues raised today will demonstrate the adverse impact these barriers have on the physical and mental health of deaf and disabled people, their educational and employment opportunities, and their frequent isolation from society. This Parliament calls on ministers, departments and public bodies to ensure the full involvement of deaf and disabled people in decisions which affect them, and further calls for strengthened interdepartmental communication so that the impacts and unintended consequences of new laws and policy changes are properly assessed and addressed.
Thank you. I now call on Joanne Sanson to address the motion. Thank you, Joanne.
Thank you, Madam Principal Deputy Speaker. Equal access to appropriate healthcare and services, including relevant and appropriate equipment, was the highest ranking issue selected by all those who completed the public survey to inform today's session. We received 1,025 responses from individual and collective voices, and I will endeavour to echo their real concerns and issues while offering a solutions-focused way forward to the ministers. Northern Ireland is experiencing chronic systemic inequalities in health care access, categorised by barriers to primary, secondary care and preventative services due to communication failures, underfunding, structural prejudices and gaps in assistive equipment provision. This results in poor health outcomes, reduced life expectancy and heightened risks from preventable conditions, compounded by deprivation and inconsistent service delivery across Northern Ireland. The absence of centralised monitoring and tailored adjustments exacerbates these disparities, particularly for those with disabilities, but extends to broader groups. In terms of health care services, we underuse GP services as a result of the increasing difficulties in making appointments, diagnostic overshadowing, in other words, symptoms getting blamed on our disability instead of being checked out alongside a lack of home visits for people with complex needs who can't get to the practice. The coordination between primary and secondary care is all over the place. Preventative stuff like health checks, cancer screenings, cervical screenings is only 30% for us versus 70% for the general public. Dental visits and promotional programs are again statistically lower because outreach isn't adapted to meet all communication needs. Indeed, communication is a big field. Professionals aren't trained well in different communication methods, resulting in little to no easy read materials, nor extra time in appointments, or much regard for other formats such as sign language interpreters, which messes with consent and care quality, compounded by underfunding and grant cuts to community groups, specialist services and advocacy, which often families are left to pick up the slack from. There's a postcode lottery in services, particularly compared to other parts of the UK, especially after the age of 19. Broader barriers like prejudice, info gaps, language issues, transport cost in rural areas, and access for older people or people with multiple disabilities limit everything, which can impact mental health. Another area underfunded despite having a strategy. Women's issues like sexual health or maternity care are often ignored. In healthcare settings, equipment and technology are often unavailable, or staff are hesitant to use hoists, etc., which can impact safety and access to treatment in the hospital.
May I intervene?
Of course you can, Amanda.
Okay. Thank you, Joanne. I'd like to add my perspective based on personal experience here. During my last hospital stay, I noticed to my delight there was a tracking hoist in the room. A welcome sight, since previous admissions to hospital for me had left me fully confined to bed. This was stressful both for my mental health and basic matters like toileting. However, when I needed it, I was informed that staff had not been trained in its use, and they had never seen it being used, and they had not seen it being used in several years. The nurses suggested speaking to the ward manager, which I did, to see if anything can be done. I did this, but she further informed me that she had also no idea when the hoist was last serviced or looked at, thus it is not safe to use. I also noticed that the hoist couldn't even go into the bathroom. What use is that? Who designed this? I contacted an MLA, who I understand raised this with hospital management, and they agreed to meet with me. I have spoken to the MLA on every available opportunity, but this meeting has never been arranged. It's frustrating to see money spent on equipment that is there for our use, that sits unused without any training or servicing given. On the subject of equipment, disabled people are often more comfortable in their own home. I am very fortunate that I am cared for by a great district nursing team in Hillsborough. This team, with advice from a consultant, visit with me regularly. Their nursing support has kept me out of hospital for more than 2 years. Hospital admissions for those with complex needs might be reduced if more patients had access to well-funded hospital-at-home services. And appropriate equipment and quality care can often be provided in a home environment. Thank you. Thank you, Joanne.
Thank you,
Thank you, Amanda. Would you like to continue, Joanne?
Yes. Assistive technology like hearing aids, wheelchairs, prosthetics and walking aids are, as I and many of us know only too well, limited by prescriptions, mirroring the UK and Irish trends, but worse in Northern Ireland due to underfunding and or a failure to offer any mitigations, even when it has been deemed a medical necessity by medical professionals at the top of their field who know the complete history. This deprivation can negatively impact our quality of life and affect our life expectancy, while also failing to comply with Article 25 of the UNCRPD, underscoring that not only is access to equipment poor and unfit for purpose, but it also denies us health support thereby violating our human rights. To address our health inequalities, there are many things this House and the Department and public bodies can do. This House could reflect the theme of this year's UN International Day of Persons with Disabilities, fostering disability inclusive societies for advancing social progress, and consider laws and policies which support an equitable rights-based approach, like Danny Donnelly's UN CRPD Private Members Bill, to implement the co-produced disability strategy to work cross-departmentally and strengthen anti-discrimination laws. Health and Social Care Trusts could be merged into one regional team to remove the postcode lottery and change the management-led decision-making approach to a meaningful co-produced approach that has staff who work in the system alongside the patients whose lives are impacted by the system at the heart, as opposed to those who commission research and balance budgets. Co-production work should include policy reform, training and resource enhancement. The Minister could mandate disability-related training for all healthcare staff, including the use of tools such as Makaton and easy-read materials, as well as regular refreshers on how to use manual handling equipment. Restore funding to community organisations and expand the Hospital at Home programme. Prioritise reasonable adjustments such as adapted screenings and assistive tech integration through multi-agency partnerships. Monitor progress and involve those with lived experience in all planning. Follow up to assess improvements. Consistent application should reduce those inequalities over time. If symptoms persist, advocate for legislative changes at all government levels, utilising a multi-ministerial executive approach that has the staff
Take your time,
utilising
Joanne.
a multi-ministerial executive approach, executive office and shared island approach, It's time to take action on recommendations and remove health and social care from life support, operate and deliver rehabilitation and keep the promise of Build Back Better. Thank you.
Thank you, Joanne. I now call on Anne Rainey.
Thank you, Madam Principal Deputy Speaker. My name is Charles Rainey and I'm here today to speak on behalf of my sister. She is non-verbal and so cannot give this talk herself, and I offer to put her experiences into words. Rest assured that this talk has been read to her and she has given her consent. Her name is Anne Rainey and she approves this message. This is not the first time that Anne and I have spoken in this building. On July, we celebrated 10 years of the current Independent Living Fund in Northern Ireland here. To Anne, her carers and friends, the issue of independent living is intimately bound up with the support she receives from the fund. The ILF goes beyond the time and task approach of direct payments and gives many severely disabled people a life worth living. 10 years ago, there were 596 severely disabled people benefiting from the fund. Today, it's 321. Together with families, friends and communities, our celebration in the Great Hall was also for all of their lives, past and present, sadly now decreasing as the years go by. 10 years ago, the original ILF was closed to all by the UK government. Here in Northern Ireland and in Scotland, disabled people, families and allies raised our voices, were heard, and it was retained. In both jurisdictions, we clearly care about our people more deeply. And why was it retained? Because it provides excellent value for money. It is twice as expensive for the Department of Health for a severely disabled person to have to live in a nursing home than it is to live independently. And if you factor in the additional engagement with society it enables, the wider economy actually gets back £13 for every pound spent. Over the last 10 years of its life, that's a staggering 800 million for a 70 million investment. But what is independent living? Well, firstly, it's a worldwide philosophy enshrined in Article 19 of the United Nations Convention on the Rights of People with Disabilities. It promotes and produces choice and control, autonomy and dignity for individuals, and supports them in the purpose of supporting them is the purpose of the ILF. The ILF supplements the constantly reducing levels of domiciliary care and direct payments provided by the trusts and supports severely disabled people to engage with society. Basically, direct payments will get you out of bed, but the ILF gets you out the front door. Practically, it keeps us out of nursing homes and hospitals, providing additional support hours and equipment where necessary. For the small number of severely disabled people who need additional assistance, it means they can live by themselves or with family. They can learn, work, contribute to society, visit friends, and have a life worth living.
Madam Principal Deputy Speaker, may the member give way?
I will.
Yes. Go ahead, Lee.
Madam Deputy Speaker and everyone, I'm speaking on behalf of Lee Martin from Enniskillen today. The Independent Living Fund is a lifeline to Lee and to all his family, and not only to Lee but also to his uncle, who is 51 and lives in Lisnaskea with carers. And in 10 days' time, well, 3rd of December, Lee will hopefully be 41. Lee worries about if something happened to me or something happened to him, more so happening to me, because then his lifeline would be cut off because I do the administration. Does the Deputy Speaker understand that having ILF, it is given that is comfort and living independently in his own home, in the community, and being supported by the community with carers? It is a complete lifeline. Thank you.
Thank you, Caroline, on behalf of Lee. Go ahead.
Thank you, and I'd like to say I understand that very much. I feel the same, as does our family. In our house, Anne decides what she wants to eat for the day. She's a big fan of MasterChef and will often choose dishes being prepared on screen for her dinner. She decides for herself when to have a lie-in, when to get up, what to do and where to go. None of these choices would be available in a nursing home. Without the ILF, Anne would not be going anywhere. She wouldn't be here today to speak to you, and she thanks you all for inviting her and listening. Without the ILF, hundreds of our most severely disabled peers are most definitely going nowhere. Opportunities denied them. It's like COVID lockdown. Remember that? People hated it, just wanted to get out of it. Well, imagine never escaping that, knowing you never will escape it. How would that feel? Minister Nesbitt, it was the decision of two of your predecessors, Minister Jim Wells and Minister Simon Hamilton, in responding to our campaign at the time, which finds Anne here today. They let the 596 people enjoy lives worth living, and our words today cannot express how much it matters and the world of difference it makes. But it is a difference.
Sorry, Charles David, do you want to make an intervention?
Will the Speaker give way?
I will.
Thank you, Charles. As Amanda said earlier, I just want to emphasise the point that the ILF is reopened in Scotland as of April 2024. That's a year and a half ago. It's been well received. People are singing its praises. It's saving the Scottish economy money. It's saving people's souls for social endeavour. It's letting the most severely disabled people get on with their lives. Almost 1,000 severely disabled people is the target. Is it not time, Charles, that we opened the ILF in Northern Ireland, both for economic and for social, and saving people's souls here?
Thank you.
Thank you, David. Continue, Charles.
The answer to all these questions is yes. For these 10 years, we've been campaigning to reopen the fund to new members in Northern Ireland. As you mentioned, Scotland did so only 1 year ago, and I would urge you to listen to what they have to say. People who in 2023 did not have a life worth living, but in 2025 do. We know what it's worth. We wish our peers enjoy its worth as well. In summary, I want to quote what one of the new recipients in Scotland had to say. The Independent Living Fund means that I can live a purposeful life and contribute to society, not just keep taking from the system. Madam Principal Deputy Speaker, Anne and I thank you for listening.
Thank you, Charles. I now call on Una Reid. Una.
Thank you, Principal Deputy Speaker. Good afternoon, everyone. My name is Una Reid and I work in Policy and Information and Disability Action. Regarding unpaid carers, I often see the issues around care and its impact. But who are the unpaid carers? They are family members, friends, neighbours who care for someone with a disability, an illness or an age-related condition. Carers span all demographics. Young carers, working age adults and older people. 222,000 people in Northern Ireland were providing unpaid care as of the 2021 census. Around 180,000 are of working age and 125,000 are employed, balancing care with their jobs and often not being able to pursue the careers they really want. Young carers often miss school, look after other siblings, and life chances are reduced. Students in full-time study, people who earn more than $196 per week, cannot receive carers allowance, and yet many care for their loved ones. Carers allowance is $83.30 per week, and if we look at someone looking after someone 35 hours minimum, that equates to 2.38 pence per hour. If you're round the clock, that's 168 hours, and that equates to 49 pence per hour. So we can see that care is very undervalued. On a personal... Yes, I will.
Okay, Caroline.
Thank you. Madam Deputy Speaker, I'm Caroline Wheeler from Enniskillen, mother of Lee and sister to Graham, who's an ILF recipient too. I'm an unpaid carer from the age of 8 years old. I provide a lot of administration work to run care packages. I'm a ward manager for ILF. I'm a scheme administrator for the direct payments, and I'm also a controller for the Office of Care and Protection. My brother Graham will be 51. He is 51 in April past. And Lee is 41 on the 3rd of December, as mentioned before. We are the invisible thread that gives them independence to live with carers in their own homes. More needs to be done to aid carers, unpaid carers, and give them a living wage and make their lives matter by recognising the work we do. We save the government billions each year, and we are the backbone to Northern Ireland. Thank you, Deputy Speaker.
Thank you, Caroline. Would you like to continue now?
Following on from that, on a personal level, I am a carer myself, looking after my husband with many needs, and I work. And even if I didn't work, I wouldn't receive any financial help because I get state pension. Many pensioners are not on pension credit, where there is an underlying CARES amount, but just above the threshold, and care is unpaid, often a couple caring for each other. I was very unwell last year and I worried for myself and my husband, and I realised the vulnerability in relying on family, friends and neighbours who kindly give their care freely, and it begs the question, who looks after the carer? This could be anyone at any time, all walks of life, even a politician. It does not discriminate. I do feel the emotional toll that all carers feel, but I am lucky to work for a disability organisation who understands that I may take time off for urgent appointments. Not all employers look favourably on carers taking time off. Carers frequently report feeling isolated, exhausted and overwhelmed. Their mental health suffers, and yes, support is limited, and yes, they get on with it. But there is hope. There is advocating for better financial support, mental health resources and legal protections like carers' leave. The Northern Ireland Assembly is beginning to listen, with proposals on the table to improve carers' rights and access to services. Still, we must do more. As a community, we need to recognise unpaid carers, not just as helpers, but as heroes. We need to raise our voices, challenge the silence and demand policies that reflect their value. Because when we support carers, we support families, communities and the very heart of society. Let's commit to making Northern Ireland a place where carers are seen, heard and supported. Let's turn gratitude into action. Thank you.
Thank you, Una. I now call on our Minister for Health, Mr Mike Nesbitt. Thank you, Minister.
Principal Deputy Speaker, thank you very much, and thank you to all the members of this Parliament. I must say you're all looking like you belong here. Perhaps, Principal Deputy Speaker, more than some of our colleagues. I don't want to get off to a controversial start, but I was brought up to talk about people with disabilities, not disabled people, because you are primarily people. So I was a bit surprised that the title is the Disabled People's Parliament. But with your indulgence, Principal Deputy Speaker, I'll use my own language from here in. So can I begin by taking an opportunity to acknowledge the importance of this Parliament, because it's important people like me hear your voice. So I spent a considerable amount of time in the Ministerial Office in the Department of Health. There is a huge amount of paperwork. I think we do about over 30% of all paperwork or correspondence for all government departments. Have a lot of internal meetings, and they're all essential, but it's not real. It's only real after Tuesday when I get out and about and I visit health and social care settings and when I engage with people like yourselves. That's when I try to get a real understanding of what I can try to do. So if I can, I'd like to address the issues one by one. So issue one is equal access to appropriate healthcare and services, including relevant and appropriate equipment. And Amanda, if you email the details of your experience, we'll see what we can do to get that machinery up and running. So this issue is a basic right for people with disabilities. Of course, they should and must have equal access to the equipment and the services that will enable them to live independently and to live as well as possible, and to provide them with the ability to make choice and decisions about their own lives. Now, I appreciate there are a number of challenges for individuals, and that's particularly at times with regard to communication. So there's ongoing work within the Regional Communication Support Service, and that's contracted by my Strategic Planning and Performance Group, the SPPG, and they work with Sign Language Interactions, SLI. And the work is to enhance experiences of people who suffer deafness or deaf-blindness in relation to communication barriers when they're trying to access health and social care communications. Now, I hope you're aware of my reset plan, published in July of this year. It represents the next steps in the outworking of the 3-year plan for health, which is based around 3 pillars. Stabilisation, which is critical that we do very quickly, then reform of how we deliver health and social care, and then delivery of better outcomes. That plan is designed to reshape the health and social care system into one that is more accessible, more equitable, and more sustainable. And for people with disabilities, that should mean better local access, faster treatment, and stronger protections against inequalities, and I am aware there are inequalities for people with disabilities. The Reset Plan sets out how we'll achieve my strategic vision, and we know that people with disability who often require timely interventions benefit directly from shorter waits and faster access to treatment. At the heart of the reform that I want to see is what we are calling the neighbourhood model. Simply put, if you need health and social care, in an ideal world, you will get it in your own home. And if not at home, as close to your front door as we can possibly get it. It's what we often refer to as shifting left, away from the focus on acute hospitals into community care, as close to your home as we can achieve. Now, this neighbourhood approach will help to tackle health inequalities, which has become something of an obsession of mine when I took up post. I had no idea that two people born in this city on the same day in the same maternity ward could grow up maybe no more than a mile apart, but because of the environment and the area in which they live, one might be in the area of the greatest deprivation and one in the least, and that means their healthy life expectancy will vary by 14 years. How is that even acceptable, a quarter of the way into the 21st century in a first world country? So in recognition of the need to ensure equal access to appropriate equipment, the Department recently completed a regional review of assistive technology and equipment provision. And this has resulted in the setting up of a Regional Assistive Technology Equipment Oversight Board. And they work towards implementation of the recommendations from that review. The work is also a component within the Reset Plan, and the focus is on a regionally consistent approach to assessment and provision. And if any of you follow me, you will know that one of my aims as Health Minister is to get rid of these horrible postcode lotteries where, depending on where you live, your access and your service may be better than in other areas. I want regionally consistent, standardised services. So from a housing perspective, my department works in collaboration with this man, the Minister for the Communities, through the Interdepartmental Accessible Homes Strategic Forum. And that forum ensures joined-up working in the delivery of accessible homes for people with disabilities. Principal Deputy Speaker, moving to issue 2, living independently. Living independently isn't just about practical support. It's about your dignity, your choice, your equality. For people with disabilities, it means having the same freedom to shape their lives as anybody else. Independent living is quite simply a right, and perhaps something many individuals take for granted. For disabled people, it means the freedom to decide how to live, where to live, and with whom to live. It's about dignity, equality, and the chance to participate fully in all areas of society. I recognise fully the difference that supporting all elements of independent living makes. Simply, it transforms your lives. So my department continues to support the provision of the Independent Living Fund to recipients in Northern Ireland. We put in £7.2 million this financial year, 2025-26. And I want to acknowledge the vital importance of ILF awards to those who receive them here in Northern Ireland and the very positive contribution they make to your lives, enabling you to exercise control and personal choice and live independently in the community. And I hear what you're saying about the ILF regarding the need to reopen the fund. As I hope you're aware, my department has faced and continues to face an extremely difficult and challenging financial landscape. Difficult and unpopular decisions have had to be made through necessity. Without a significant change in the budget, it's unlikely we'll be able to make all the decisions we want to make in the future. However, my officials have continued to liaise closely with ILF Scotland's senior management team and the ILF Scotland Northern Ireland Advisory Group regarding the potential to reopen the scheme. And in reflecting that engagement, I'm advised officials will later this month provide advice for consideration by my Permanent Secretary and myself regarding this proposal. It does remain the case, however, due to the very significant and challenging financial position I face, the issues of funding affordability and sustainability remain key for my consideration going forward. And as Amanda has asked me to do the right thing and make the right decision, Principal Deputy Speaker, let me take a moment just to talk about the decision-making process, because yes, I am a minister, and ministers are put in place to make decisions. But our ability to make decisions is not unchecked. And it is far from uncommon for me to sit with my senior official, who is the Permanent Secretary, and say, here's something I want to start doing, because it's good. And the official will look at the proposal, and he may say, actually, I agree, that's a really good proposal, but I am the accounting officer. I have legal duties with regard to this department's budget, and on that basis, I have to tell you, regrettably, you cannot afford to do it, so it's not going to happen. So I'm just trying to be honest and open. I do want to reopen the ILF. Can I do it? I do not know yet, because I don't know my next year budget. Now, I do understand ILF Scotland's Northern Ireland Advisory Group is meeting on the 9th of December. That's an Assembly sitting day, so I don't know to what extent I'll be required in this chamber, but I will make it my business to spend time at that meeting, if only to hear directly from the group members about this important issue. So let me just say, as Health Minister, I remain committed to supporting all individuals to live independently in accordance with their wishes and in a home of their choosing. Last but by no means least, issue 3 is unpaid care and support. One of my department's key objectives is to support people to live independent lives within their community. The invaluable support that unpaid carers provide enable many thousands of vulnerable and people with disabilities to do this. So it's imperative to me carers are supported in their caring role so they can continue to care for as long as they wish and are able to do so. Excuse me. I'm aware unpaid carers report that respite care services and provision is often inadequate or difficult to access, and that places a strain on their own well-being. This affects both those caring for disabled adults and older people, as well as parental carers caring for children who often have complex needs. To help tackle the inadequacies felt by carers, those they care for, and for their families, my department is currently working in a collaborative partnership with Carers NI and Carers with Lived Experience as part of the Social Care Collaborative Forum. This group has made some significant progress, and I'll list a few of them. The establishment of a cross-departmental senior officials group. They look at cross-cutting issues affecting carers in a collaborative way. The Carers Register function on Encompass went live in July of this year. Trusts are now in the process of migrating cases over from their local systems to the regional digital service. Thirdly, carers can create their own account on the MyCare app and request proxy access to the account of the person who is receiving care. Once that consent is given, the carer can view appointments, can manage medications, can communicate with care teams, and can access test results. If you don't have it, I have it. It's a magnificent app altogether. Next, health and social care professionals can see who's registered as a carer and whether they've been offered a carer's assessment and what the outcome of that assessment has been. Penultimately, the Supporting Carers workstream is continuing to look at ways to improve information for carers. And finally, the HSC Leadership Centre recently completed an independent evaluation of the implementation of the 2006 Caring for Carers strategy. The Supporting Carers workstream is currently examining the next steps. Now, the 2010 Equality Act provides protection to 9 different groups from discrimination. It also provides protection to carers by extension in that they cannot be discriminated against because they are caring for somebody. The whole of the UK holds the same position on this, but I'm aware some carers would like the list of protected groups to be extended to include unpaid carers. Well, this type of change would require cross-departmental support. And I've asked my officials to raise the topic for discussion at a future meeting of the cross-departmental senior officials group. Principal Deputy Speaker, I would again like to thank you and members of the Parliament for giving me this opportunity to address these important issues today. I would simply like to reiterate my commitment to improving services for all people with disabilities in Northern Ireland, to ensure they're given equal opportunities and equal access to our health and social care system, and to do all that's possible to support people with disability to live the lives they wish to live. Now, I know Amanda made the point there are only 2 executive ministers here today. I'm not going to criticise the others because they're all busy and I don't know what their schedules are like today, but I would say this. I am convinced, and I'm sure Gordon would agree, there's very little we want to achieve as an executive and as an assembly that can be achieved by a single minister or a single department. So collaborative working is the only way to go if we want to achieve for you. I apologise, I'm not able to stay for the rest of today, so I'll explain why. At least once a month, I try to visit an establishment called Kimberley House. It's a praxis care home in Newtownards, and for a long number of years I've gone to visit, well, he's 30 now, a young resident there, and today's the Friday that I go to see him this month. And if I'm not on time, Rory gets very upset, so I need to run. But thank you very much.
Thank you, Minister. I now call on Farah Black.
Madam Principal Deputy Speaker, Ministers and everyone gathered here today. My name is Farah Black, founder of Spendabled. I deliver this speech seated in my wheelchair, not as a symbol, but as a reality. A reality that far too many people in Northern Ireland have to live with every day. I'm not asking you to imagine disability, because you couldn't. I'm asking you to look directly at the lived truth of people who for eons have been excluded, overlooked and left behind by a transport system that was never built with us in mind. Let me be plain. A society where disabled people cannot travel freely is not an equal society. That is not living. It's abandonment. Transport is the foundation of freedom. Without it, everything falls apart. Independence, dignity, opportunity, community, participation, none of it is possible if people can't physically move freely and or independently. For disabled people in Northern Ireland, every journey is a risk. Do they have a ramp? Will it work? Will they know where it is? Will the driver stop for us? Will the staff help or look the other way? Will the taxi charge me more because I have my wheelchair or other equipment? Will they even pick me up or tell me, no space in the boot for your wheelchair, or it's a two-man job? These are not dramatic questions. They are everyday realities for us. And that uncertainty, it erodes away at your self-confidence, your energy. It eats up your self-worth, and it takes huge chunks out of your mental health. Your sense of belonging, there isn't one. When transport fails our community, it fails everyone. You can't take a job if you can't get to it. You can't maintain your health if you can't attend your medical appointments. You can't pursue your education if the bus, train, or taxi thinks you're invisible. You can't be a part of your community if there is no safe, affordable way to participate. Transport is not a separate issue. It is the backbone of every opportunity this society claims to offer. There is also an emotional cost no one talks about. When a bus flies past you, you feel invisible. That moment when you sit alone at a station with no help in sight, you feel scared. The moment you fail your child because the system makes it impossible. These moments, they stay with you. They shape you and the person you have failed. They shrink your world until it becomes just your home and then your room. No person in Northern Ireland should have to live that way. And here's the part that really matters politically. Inaccessible transport is expensive. It is costing our country millions through missed work, missed education, preventable health problems, the deepening isolation and the increased dependency on our already heavily pressured social care and mental health care services. But when we can move freely, we can contribute fully. We can work, shop, study, socialise, volunteer, raise families, and we can do all of that. And we can support our local economy. We can do it all. The purple pound is real, and Northern Ireland is missing out because we stumble at the first hurdle. Disabled people aren't looking for extravagance. We just want a transport system that works for everyone. Buses, planes, trains and taxis with affordable and easy accessibility. Staff trained through lived experiences, not outdated theories. Rural routes that connect communities instead of isolating them. Taxis that treat us with the fairness and respect we all deserve. Decision makers that include us from the beginning and not see us as an afterthought. Nothing about us without us means nothing. It's just a slogan. We need to work hard together. We need to get transport working for all of us. I would like you to imagine a Northern Ireland where disabled teenagers can travel to college without fear because they are seen, where parents can take their disabled children out without having to plan a military operation, where rural towns are connected instead of forgotten, where wheelchair users board public transport without fear, where accessibility is the norm everywhere. Now that is a Northern Ireland worth building. And it's a Northern Ireland within our reach. Ministers, members, this is not just about transport, it's about health. Those missed appointments, the isolation, the harm it causes people. It's about education, because access shapes opportunity. Our economy because moving a population is a contributing population. It's about communities. It's about human rights, because no person should be denied participation because the bus never stopped for them. Northern Ireland has the chance to lead, to be the first to choose solutions over excuses, to build the first of its kind, a country where the disabled aren't fighting to move freely, but are supported to thrive. I'm Farah Black, delivering this speech from my wheelchair, not as a limitation, but as a reminder that the disabled are here, we are present, but we can't keep waiting on the sidelines, hoping that maybe, just maybe, that day will arrive. I promise to work with every government, every local authority, operator, every minister, community, just to create this transport system that will include all of us. I want to leave you with this. It's time to join this movement for accessibility, not because it's politically convenient or it looks good on a report, but because every person here in Northern Ireland and beyond deserves to live freely, to feel like they belong, to thrive. The movement is real and it's begun, and together we can build a Northern Ireland where no one person is left behind. Thank you.
Thank you, Farah. And before I bring Owen in, I just want to say any concerns that have been raised that don't involve the Minister for Communities or the Minister for Health, I will ensure that the Hansard of this debate is sent to the relevant minister in their department. So it's just to give you that assurance. Owen, over to yourself. Thank you.
Hello, and thank you, Madam Principal Deputy Speaker. I want to highlight the education opportunities. My name is Owen Kenny, and I have a learning disability. People with disabilities are the heart of MenCamp. As an organisation helps them realise, as an organisation realises their true selves and understand what they can achieve with support and have their voices heard. Today, I'd like to talk to you about the need for reasonable adjustments and education opportunities for people with disability. According to the recent research, people with disabilities in Northern Ireland are almost 3 times as likely having no education qualifications. Also, only 5% of people with learning disabilities are employed according to the UK government. We need to normalise education of people with learning disabilities within the mainstream education. We need to encourage acceptance. When it comes to my personal story, you'll see in many ways why good education support is needed. I was very lucky to have parents who knew how to support my learning. I was lucky from the time I was in primary school, I got the right kinds of support, and after I left secondary school, my parents were able to help me as I entered Northwest Regional College. But my parents had to work very hard and sometimes had to really fight for me to get the right support to allow me to progress through college. When I first started primary school, the Education Authority only recommended that I get a few hours of a class assistant each week. I was also then allowed to attend a speech therapist, and this helped me to communicate better. During that time, I found it hard to communicate with people as I was very withdrawn and shy. There is an overwhelming crisis that many people are expressing a big concern and the crisis is getting bigger.
Owen, I think Caleb wants to ask for an intervention. Is that okay?
That's great. And
Will
Hi,
the member
Caleb.
give way?
of course I will.
Thank you,
Thank you,
Caleb.
Owen. Madam Principal Deputy Speaker, my name is Caleb. I'm 17 years old. When I get older, I want to be an inventor. While he's Special Scott 19, my opinion options will be limited. I want a lifelong care plan to allow me to fulfill my potential and achieve my dreams. My friends and I, along with my others, want to be seen, heard and included in your world. We want laws to give us a future. We are human beings just like you. Executive ministers and departments, you all can choose to help me and so others in this mandate. My question is, will you?
And thank you, Keela, for your wonderful contribution. The key thing is how early intervention can help, as it did in my case. With the right support, families can plan for their child's education journey and help them to be the best versions of themselves. Of course, no person with a learning disability will be able to succeed without reasonable adjustments being made to help their school, college, or apprenticeship journeys. This can be done within the mainstream curriculum as it was done for me.
Owen, I think Joanne is behind you indicating. Would you like to ask Owen for an intervention, Joanne?
Yes, will the speaker give way?
Of course I will, Joanne.
Thank you,
Hello.
Joanne.
My name is Joanne MacDonald, and I want to talk to you about why reasonable adjustments are important for people with a learning disability. We all need the right support to do our best, whether that's in mainstream education or special education. It's not a one-size-fits-all. I myself went to special school, and this was the right place for me. The support I got helped me to develop to be the person I am today. Learning is a lifelong journey, and staff need training so they know how best to support us, to support people with a learning disability to reach their full potential. When we get the right support, we can learn, achieve all our goals and take part fully within our society. Thank you very much for listening to me today.
Thank you, Joanne. You may continue, Owen.
And thank you, Joanne, for the wonderful contribution. Today, there's a lot of frustration with the SEN system, with many people expressing in long delays in getting this support and adding to the overwhelming crisis for families. I'd also like the different government departments in Northern Ireland to work closely together. When we work as a team, the changes we're planning can do a much better job of helping children and young people who have a learning disability. And thank you, Madam Principal Speaker.
Thank you, Owen. Okay, our next speaker is Rory McCartney. Rory.
Thank you, Madam Principal Deputy Speaker. Today I want to talk to you about an issue that affects thousands of disabled people, the ongoing review of personal independence payments, known as PIP. PIP provides essential support to cover the additional costs that disabled people face every day. They're not frivolous expenses or luxuries. They're the basic necessities of daily life that simply cost more when you're disabled. Let me give you one example. When public transport is inadequate or inaccessible, disabled people must rely on taxis to get the medical appointments, participate in work, or simply participate in their community. These additional costs add up day after day and month after month. The reality is stark. Disabled people are already more likely to live in poverty than those without disabilities. They face systemic barriers to employment, higher living costs, and persistent economic disadvantage. PIP helps to level that uneven playing field.
Way?
Yeah.
My name's Niamh Scullion. I work for Disability Action, and previously I worked as a creative freelancer. Disabled creative freelancers can face significant barriers when accessing benefits due to the mismatch between fluctuating, irregular freelance work and rigid benefit systems. Many benefits require predictable hours, stable income, and strict reporting, which are often incompatible with project-based, fluctuating creative work. Disabled freelancers may also face long gaps between commissions and inaccessible application processes for benefits that rely on extensive paperwork or medical evidence. Fear of losing essential support, such as PIP or housing benefits, discourages many from taking short-term projects. Additionally, welfare assessments often fail to recognise the realities of creative labour, leading to underassessment and financial insecurity.
Rory, you're okay
Thank
to
you, Niamh.
continue. Thank you. Thank you for that intervention.
So this is why getting the PIP review right is so critical. With PIP assessments set to determine whether disabled people on universal credit receive extra vital support, getting the TIMS review right just isn't a matter of policy, it's a matter of survival. Now there is some positive news in all of this. The TIMS review of personal independent payments is being co-produced with disabled people. However, this will only be meaningful if it includes the full diversity of disabled people's voices. And this is where I want to focus our attention today, the voices of disabled people living here in the North. In the North, we have our own unique context, different public services, different infrastructure, different challenges. Disabled people here in the North face specific barriers and costs that may differ from other areas. Their lived experience is vital to ensuring the PIP remains fair and adequate. When we talk about lived experiences, we're talking about real expertise. Disabled people know what works, what doesn't. They know where the gaps are. They know what support makes a difference between isolation, participation, between poverty and security, between managing and struggling. This isn't just good practice, it's essential for creating a policy that actually works. So I am calling on the Department for Communities to ensure that throughout their consideration to the TIMS review, that disabled people from the North are meaningfully included in this co-production process, not just as a token gesture, but as an equal partners with real influence over the outcomes. The future of PIP will determine whether thousands of disabled people can continue to live with dignity and independence. We must get this right, and we can only get it right by listening to and genuinely collaborating with disabled people themselves. Nothing about us without us. Thank you.
Thank you, Rory. I now call on Nuala Toman.
Thank you, Deputy Principal Speaker. I'm Nuala Toman from Disability Action. Disabled people have the right to social security, to an adequate standard of living, to social protection, and to live free from poverty. Article 28 of the United Nations on the rights of disabled people makes this responsibility clear. Yet across our communities, too many disabled people experience the opposite. We face higher living costs, reduced income opportunities, inaccessible housing, soaring energy costs and food insecurity, and a welfare system that is adversarial, particularly in the context of what Rory has outlined with the focus on reducing access to PIP and the current debate around limiting access to Motability, which is a scheme that facilitates disabled people's right to independent living. If we're honest, many people in the room today would not have been able to travel here without access to the Motability scheme. In the society that we live in, the risk of poverty for disabled people is not just likely, it is almost inevitable. Adequate social protection is not simply about surviving. It is about having enough to participate fully in society, to pursue education and employment, to contribute to society without barriers, to form connections and to live with autonomy, choice and dignity. The current system that we have forces disabled people to prove their disability time after time after time. It is a system that leaves people waiting for assessments and that creates fear and stigma. This is not a system that offers social protection, it is a barrier. We've heard from David, we've heard from Amanda, and we've heard from Caroline and Lee and Anne about the importance of the Independent Living Fund. And if we are to talk about social protection, the Independent Living Fund is an essential step in the fabric that is required for disabled people to fully participate in society. The ongoing threats to welfare provision, combined with the position that have labelled disabled people as scroungers, are not just abhorrent, they are dangerous. The media's current reflections and the positions taken by the Westminster government influence negative perceptions across society of disabled people and lead to increased hate crime. These perceptions need to be challenged, and we would ask the Northern Ireland Executive and Assembly to challenge the stigmatisation and negative portrayal of disabled people. We need a welfare system built on trust and real co-design. We need a social security system that addresses the real costs of disability, which are estimated at over £1,000 per month. The current disjointed system barely touches the side of that cost. Disabled people should not be forced to choose between eating and breathing, and that is the grim reality for many in our society who cannot turn on their heating or use essential machinery at home due to the rising energy costs. No disabled person should have to rely on a food bank. But sadly, the largest proportion of people accessing disabled food banks in this jurisdiction are disabled people. We need housing that is secure and accessible, energy and transport policies that consider disability, and employment pathways that do not punish disabled people who try to engage. Most importantly, we need a societal shift that sees social security as a human right and an investment in collective well-being, a fair society that protects everyone. We know there is a draft anti-poverty strategy. We would ask that anti-poverty strategy is adequately resourced, that it contains legislative commitments, and that it realises commitments that are made under Section 28E, and that resources and decision-making that is undertaken at the level of the executive is taken on the basis of objective need. We need a fair society that protects everyone. If we get things right for disabled people, we get things right for everyone. And a society that protects disabled people does not merely reduce poverty, it unlocks potential, participation and equality for all. Thank you very much.
Thank you very much, Lula. I call on David Mann.
Thank you, Madam Principal Deputy Speaker. I'm David Mann, severely sight impaired from birth and now with a developing hearing impairment as well. Social isolation has already been alluded to by many of the preceding speakers this afternoon. It's a vicious circle. The less social contact you have, the more depressed you get. The more depressed, the less confident. The less confidence you have, and the less confidence, the more difficult it is to get out and meet people. There are many routes by which social isolation can be mitigated. Families, neighbours, voluntary and community organisations, both specialist and mainstream, and of course statutory services. But I'd like to concentrate this afternoon just on a couple of areas where lawmakers and budget allocators can make a difference. The greatest trauma for many people who acquire a disability as they age, and this is particularly true of people who are losing their sight, is no longer being able safely to drive. Independence and flexibility disappear. Isolation sets in. Thus, we need to see far more investment in community transport, and especially rural community transport. Current schemes are inflexible. They need advance booking. They are often limited in the distance they can take you, as they depend on volunteers. Now let's acknowledge and commend those volunteers, but why is such a vital service dependent on volunteers? Trains, buses, taxis are not. So the Ministers for Infrastructure and for Rural Affairs need to collaborate to prioritise the expansion of this service. And if I might now turn to the challenges faced by many people who want to get out and about in our towns and cities. No amount of mobility training with a cane or a dog can remove the myriad, often unpredictable hazards on our pavements. Parked vehicles, overgrowing hedges, dog mess, shop displays, cafe furniture, wheelie bins. Now, if you bang your head on a lorry's wing mirror during your 20th or 30th walk along a particular street, you may well just shrug it off. Shrug off the incident, not the head. But if this happens on only the first or second attempt at independent mobility, then your confidence can be shattered and you simply won't try again. The Minister for Infrastructure has recently issued proposals to curb what she terms inconsiderate parking. Antisocial would be a better term. Her proposals are sadly inadequate. In most instances, they would sanction, that is to say, they would give the seal of approval to cars parking on pavements with two wheels still on the carriageway. A vehicle with 3/4 of its mass on the pavement would make many pavements impassable and force pedestrians out into the road with all the dangers that that entails. Yet the new measures proposed would only prohibit parking with all four wheels on the pavement. So we call on the Minister to radically review her proposals before submitting them to the Assembly. Many of our cafes, pubs, restaurants put chairs and tables out on the pavement in a vain attempt to recreate a sunny continental resort. In reality, these are just pens for smokers. Local councils have the power to introduce licensing schemes to regulate the extent and design of such enclosures. We call on the Minister for Communities to ensure that all councils implement and enforce such schemes. Madam Principal Deputy Speaker, you will be relieved to know that time does not permit me to go into the details of what could and indeed should be done to combat dog mess on the pavement. Instead, I will simply ask everyone to help bring about a fundamental change in public and political thinking so that pavements are recognised as being exclusively for pedestrians, for walkers and wheelers, so that we can combat our social isolation by getting out and about without fear. Thank you.
Thank you very much, David. I now call on Laura Murphy-Sloan. Thank you.
Thank you, Madam Principal Deputy Speaker. So good afternoon. Thank you for inviting me along to speak today and highlight about barriers to employment. My name is Laura Murphy-Sloan and I'm here representing Adapt NI. We are the only organisation in Northern Ireland providing specialist employment support for the deaf, hearing loss and tinnitus communities. My sign name is Laura. I want to begin with why I'm here. Every day we support people who are skilled, motivated and ready to work, yet they face barriers that stop them entering work, progressing in work or feeling included in their workplace. I want you to feel the urgency of this because these barriers are avoidable. And that urgency is growing. Right now, we are fighting to secure the future of specialist employment support beyond March 2026, when the Shared Prosperity Fund ends. Working alongside NICFA and other organisations, the NI Can't Wait campaign to push for long-term, stable investment in services that should never be at risk. Adapt NI launched without even a laptop or a phone in 2022 to continue specialist employment support. Only determination and lived experience. But in 2025, it is unacceptable for the only service of its kind to have no confirmed budget for the following year. That uncertainty is a barrier to us and a barrier to the communities that we support. This comes at a crucial moment because the sign language legislation moving through Stormont represents long-awaited recognition for both BSL and ISL users in Northern Ireland. This legislation will place obligations on public bodies, raise standards, and help ensure communication rights are respected, but legislation alone cannot create access. It must be backed by infrastructure, training, and specialist support that organisations like ourselves and others can provide. Without secure funding, these rights promised in legislation risk becoming symbolic rather than real. So what are the barriers that people are facing right now? Well, they begin even before someone applies for that job. Recruitment processes remain inaccessible, job adverts without clear information, telephone screenings that automatically exclude deaf applicants, and no offer of communication support. In fact, many people disclosing their deafness feel that will count against them during that process.
May I intervene?
Yes.
Madam Deputy Speaker, can I interrupt to emphasise the impact of poor communication support? As a deaf BSL user who is also deaf-blind, I depend on interpreters and tactile communication. When this isn't arranged, I can't fully participate. Whether it's an interview, a training session, or a staff briefing. Often, the support arrives late or not at all. Sometimes the interpreter booked doesn't have the right skills for deaf-blind communication. These gaps push me out of opportunities that I am qualified for. If employers and services planned communication support properly and recognise the specific needs of deaf-blind people, it would remove one of the biggest barriers we face. Thank you.
Thank you, Laura, and indeed to Christina for interpreting for Laura. Laura, you may continue. Thank you.
Thank you. An interview stage, things can sometimes get worse as well. Interpreters aren't always provided. Lighting and acoustics can be poor, and interviewers can lack deaf awareness. Brilliant candidates are overlooked because the environment doesn't allow them to show their strengths. If somebody wants to retrain or upskill, they may find that online courses have no captions, or the tutors, they aren't deaf aware, and then there's minimal support. The very opportunities that should enable progress end up shutting people out. And even once in work, barriers can continue. Meetings without interpreters, inaccessible technology, social isolation, and constant exhaustion. Essential schemes like access to work can be slow and complex, and there are rigid rules around this which can make it difficult to access, for example, if you work under 16 hours per week. So why does this matter? Because these barriers don't just affect individuals. They limit employers, they weaken communities, and they hold back society by preventing people who want to contribute from doing so. The problem isn't the person, it is the environment. Yes, I will.
Thank you.
Thank you, Eva.
My name's Eva Hanna, and 4 years ago I became a full-time wheelchair user, and I quickly realised how many barriers exist that most people never even have to think about. When I first started applying for jobs, it was honestly nerve-wracking, not because I doubted my ability, but because I had no idea whether the workplace would be accessible, whether people would understand my needs, or whether I would be judged before I even had the chance to prove myself. But disabled people want to work. We want to be part of the world, to contribute, to have purpose, and to use our skills like anyone else. We have the same drive and motivation, and having a disability doesn't make us less capable. It just means we have to do things differently. I got my first job this year since becoming paralysed, and it only happened because my employer was truly inclusive. They listened, made adjustments where needed, and treated accessibility as a standard, not something special. That is what inclusion looks like, and it shouldn't be rare. If we want more disabled people in employment, we need accessible transport, flexible workplaces, and employers who are supported to make real adjustments. We don't lack the ability or ambition, we just need a system that lets us in and a society that believes we belong there. Thank you.
Thank you, Eva. You may continue, Laura.
Thank you. So what needs to happen? We need accessible recruitment from the very start. We need support schemes that work in real life, not just in policy documents. We need deaf awareness embedded across workplaces, so communication becomes assured, not left to one person to manage. And we need stable, long-term funding so that organisations like ourselves and others can deliver specialist support. In particular, ourselves when it comes to the upcoming sign language legislation, it will depend on this nature of support in place. At Adapt NI, we see every day what is possible when barriers are removed. People thrive, employers benefit, and workplaces become more equal and more effective. Thank you for your time.
Thank you very much, Laura. I now call on Gerard Heatley.
Thank you, Gerard. Beside me is Gerard Heatley, who is a deaf man from Northern Ireland. I am very privileged to be with Gerard today to assist Gerard in communicating his words.
Despite the fear application and the fast assessments, simplifying the options of virtual assessment. The reality is clear. Affordable and accessible rights for health at the disabled people are always impossible to find.
Access to safe, inclusive housing is a fundamental human right. Yet for deaf individuals in Northern Ireland, this right remains out of reach, Despite repeated applications and requests for assistance, suitable housing options are virtually non-existent. The reality is clear. Affordable and accessible housing for deaf and disabled people are almost impossible to find.
The housing system designed to support the affordable groups often feels those instructions attacked. According to the authority system, deaf people experience the highest levels of discrimination below disabled groups, largely because are used or overlooked by organizations such as the Partnership of Disabled Persons, known as Act 1970. Exists. The housing sector does not adequately consider these provisions when processing applications or engaging with deaf applicants.
The housing system designed to support vulnerable groups often fails those it is meant to protect. According to the Equality Commission, deaf people experience the highest level of discrimination among disabled groups, largely because our needs are overlooked. While legislation such as the Chronically Sick and Disabled Persons Northern Ireland Act 1978 exists, the Housing Executive does not adequately consider these provisions when processing applications or engaging with deaf applicants.
Current policies do not prioritize disability or housing, even when existing homes are unsuitable treatment. For deaf individuals, this creates additional challenges. Essential adoptions such as visual alarms, sighted disabilities, or assessment of communication with housing options are very starting relationship. Accepting the first disabled property is the only option when simply cannot be guaranteed. The constant anxiety of missing a fire line or resident at the door is a daily reality.
Current policies do not prioritise disability on housing lists, even when existing homes are unsafe or unsuitable. For deaf individuals, this creates additional challenges. Essential adaptations such as visual alarms, vibrating doorbells, and accessible communication with housing officers are rarely standard, though they should be. Accepting the first available property is not an option when safety cannot be guaranteed. The constant anxiety of missing a fire alarm or visitor at the door is a daily reality.
For over 3 decades, the housing sector required me to live in very good accommodation. Only after challenging this discriminatory practice with support for disability action was granted a housing transfer in June 2025. This experience underscores a broader issue. The housing crisis is not only about affordability, it is about dignity, independence, and equality.
For decades, the Housing Executive required me to live in ground floor accommodation. Only after challenging this discriminatory practice with support from Disability Action was I granted a management transfer in June 2025. This experience underscores a broader issue. The housing crisis is not only about affordability, it is about dignity, independence, and equality.
When policymakers speak of affordable housing, we must ask, affordable for whom? When we promise choice, where is ours? Despite constant purpose applications, appeals, evaluations, the response remains the same, wait and wait longer.
When policymakers speak of affordable housing, we must ask, affordable for whom? when they promised choice, whereas ours, despite countless applications, appeals, letters and meetings, the response remains the same: wait and wait longer.
All seek is a home that ensures safety, enables communication, and support independent living, basic rights that should never be negotiable.
New developments continue to rise, marketed as modern living and vibrant communities, yet deaf and disabled people are excluded from the design stage entirely. All we seek is a home that ensures safety, enables communication and supports independent living, basic rights that should never be negotiable.
As a call to action, we urge government bodies, private designers, and local officials to integrate accessibility for the design stage of the housing developments. New application process fully accessible for deaf and disabled applicants. Fund essential adaptive outlet to ensure safety and independence. Use beyond consultation to fully design working with deaf and disabled people. Thank you.
We urge government bodies, housing providers and local councils to integrate accessibility from the design stage of all housing developments, make application processes fully accessible for deaf and disabled applicants, fund essential adaptations promptly to ensure safety and independence, move beyond consultation to co-design, working directly with deaf and disabled communities. Thank you, and thank you, Jared, for having me support today. Oh, I've missed, there's another page, apologies. Sorry, I thought we were finished, sorry.
Until that happens, I try to thank you when the years trapped, not by our experiences or purpose or disability, but by our system that refuses to be with us. Thank you.
Until that happens, I and thousands like me will remain trapped not by our experiences of deafness or disability, but by a system that refuses to move with us. Thank you, and thank you, Jared. Thank you.
Thank you, Jared, and also thank you, Nuala. Our last speaker is our Minister for the Communities, Mr. Gordon Lyons. Minister.
Thank you very much, Principal Deputy Speaker, and can I thank the organisers for bringing together today's Parliament and today's debate, and can I thank you, Principal Deputy Speaker, for your presence here today, and for all of the Assembly staff that have made this possible, and for our translators as well, and to all of those who have not only made today's event possible but accessible as well. I want, though, most of all to acknowledge and thank those who have contributed to the debate today. I know it's not easy to stand in this place and to speak, and especially to speak on issues that are so personal to you. But I think as a result, we have had powerful, passionate and principled speeches. And I have to say, the atmosphere here has been much more polite than perhaps we are normally accustomed to. Principal, thank you. And I have to say as well, the Principal Deputy Speaker has shown a different side to herself today as well, because normally she's very, very strict when it comes to time. and she keeps everybody, and she only lets us go over by a second or two at most. So I hope this newfound flexibility will extend to us next week. She's shaking her head, so I assume that this is a one-off, but it was right because we should hear from all of you. You all were speaking not just about your own personal experiences, but I know that you were speaking on behalf of many other people as well, and I want to thank you for that. I got the invitation to come here today, and normally when something comes in on a Friday, it's nearly always an automatic decline, because on Fridays most MLAs are in their constituencies, but I made an exception, and I made an exception today because this is important. But it's also deeply personal to me. Now, this is an issue that I have a deep interest in, and so I want to say it is genuinely a privilege, but also a delight for me to be here today, and I want to thank you for making this possible. Because I believe that deaf and disabled people deserve the chance to live freely, and to work and to participate fully in society. And too often barriers stand in the way, and my responsibility as Minister for Communities is to help remove those barriers in the areas that I'm responsible for, such as social security and housing and employment. And I believe that the Executive Disability Strategy will help deliver this lasting change that we all need to see. And I can guarantee you today that this will not simply be a wish list. It will contain substantive actions that will make a real difference. And from the outset, I want to assure you that this has been a genuine co-designed process involving deaf and disabled people, their families, carers, and representative organisations. And I want to thank all of those who took the opportunity to share their views and assist my officials in this work. And from an early stage, it was clear that there was a number of key asks coming from the sector about what they wanted to see in the new strategy. And one of the strongest and most universal messages was the desire to establish a Northern Ireland Disability Forum, wholly comprised of deaf and disabled people, with a role in supporting the monitoring and reporting processes for that strategy. Another was the call for reform of the Disability Discrimination Act 1995, which stakeholders believe is no longer fit for purpose. And I can confirm to you today that both of these key asks are commitments within the latest strategy. So, on Monday, the 24th of November, I will announce the details of the draft strategy and its public consultation. And this is your opportunity to review what we plan to do and help ensure that it truly reflects everyone's needs and their aspirations. Once consultation closes, I will publish a detailed action plan with clear actions, timelines, and responsibilities subject to executive agreement. And I will continue to work with you during implementation as well. Because as I said before, and on many occasions, I am committed to ensuring that every single individual, regardless of disability or health condition, has the opportunity to fulfil their potential. Now, the UK Government's Pathways to Work Green Paper set out a clear commitment to help disabled people try work without the fear of losing the support they rely on. For too long, the system has made work a risk, and people should not have to choose between financial security and the chance to see if work is right for them. So I welcome proposals that will allow disabled people to take up work on a trial basis, safe in the knowledge that their benefits will not be affected if the work proves unsuitable. I was also pleased that proposals to change PIP rules were removed from the Universal Credit Act. That was the right decision. And the TIMS review of PIP is now underway, the first full review of its kind, and it will be co-produced with disabled people and representative organisations. And this review will help ensure the system supports better health, higher living standards and greater independence. And I want to thank Rory for raising this issue and highlighting the personal importance it is to him. And I can confirm that I have emphasised to Minister Timms the importance of lived experience and the lived experience of people here in Northern Ireland in particular. Let me move on to another issue which is so important, and that's housing. And I believe that housing is the foundation and the stability that we need for so much in our lives. Because housing, it's not just about bricks and mortar, it's about people, it's about places, it's about potential. And the housing supply strategy, developed after extensive consultation with stakeholders, including disability organisations, recognises the need for affordable and accessible homes for a diverse range of needs. Too many disabled people still live in homes that do not meet their needs. And that's why my department, working with executive colleagues and the housing executive, is developing an action plan so that we can actually deliver practical solutions to those issues. I'm also reviewing the Disabled Facilities Grant to make the process quicker, easier and more responsive. Proposals for change will be included in a public consultation next spring, and I encourage everybody with lived experience to take part. In addition, as part of the fundamental review of social housing allocations, work is underway to look at how specialised accommodation, such as sheltered housing, wheelchair standard homes and adapted properties is allocated. And the aim is clear: to create a fairer system that gives applicants better access to good quality homes and, importantly, supports independent living. I want to move on to another issue, and something which we need to do far, far better on, and that's Northern Ireland's disability employment rate. Quite simply, it's not been good enough, and I am determined to change that. And that's why I launched the Disability and Work Strategy, which aims to support 50,000 disabled people into employment over the next decade. And again, the strategy was co-designed with those who have lived experience, and it focuses on tailored support, employer engagement, and breaking down structural barriers. This is so incredibly important, and that's why I want to thank Eva Hanna in particular for her intervention today, who so clearly outlined the importance of work and those small steps that can be taken by employers, which make such a massive difference in helping people get into the workplace. So thank you for your contribution on that today. I also want to take this opportunity to acknowledge the vital role of the voluntary and community sector in representing people and communities and in promoting well-being, resilience and inclusion. Your work is at the heart of building stronger, more connected communities. And I'm proud to support the sector's efforts to deliver well-being and inclusion outcomes through investment under a range of programmes that empower communities, provide housing support, enhance employability and promote participation in sport, culture and heritage. I also want to highlight the progress of what I hope will be one of my proudest achievements during my time in office, and that will be the Sign Language Bill. And I know that this legislation will be a landmark moment for the deaf community in Northern Ireland. It will give formal recognition to British and Irish Sign Language and place clear duties on public bodies to promote and facilitate their use. It will mean better access to information, services and opportunities for deaf people, and I'm very proud that this House is bringing it forward. And I'm committed also to inclusive urban regeneration, because we need to ensure that deaf and disabled people are not just consulted, but actively involved in shaping the places that we all share. Through strong engagement with organisations like Disability Action, Guide Dogs and RNIB, my department has embedded accessibility and inclusion into projects such as the 5 Cs and the Belfast Streets Ahead programme. And I know that we still have so much more work to do, and work that government can't and shouldn't do alone. And that's why it is so important that we hear from you all today. And although not a direct responsibility in particular, Farah, I hope you don't mind me singling you out for an incredibly passionate and powerful speech, and I'm glad that the Principal Deputy Speaker will be sharing contributions with other executive ministers, because I think it does demonstrate the importance, and not just the importance, but the requirement for us to all work together, because it's not just about ticking boxes either. I see so much of this work as unleashing potential, the potential that so many people have, but that is held back because of barriers that we should have knocked down a long, long time ago. So I understand this issue, and I am committed to doing everything I can and to playing my role in that. And so I look, as we look ahead, I want to be very, very clear. I will continue to listen. I will continue to learn, because I know we don't always get it right. And I hope that we will also be able to act together with deaf and disabled people to create a culture of inclusion, to build a society where your voices are heard and you can shape decisions, not as an add-on, but as a very core part of every single engagement that we have. I hope that this has been a useful debate and session for you. It certainly has been for me. I think it has been a good debate. Principal Deputy Speaker hasn't had to tell me to sit down, or she hasn't called order and told me to behave myself, so I suppose that's one benefit that we can take from it as well today. But I think that we have had a good engagement, and please be assured that I will listen, that I will learn, and I will do everything that I can to work alongside you to deliver the change that we all want to see, because I see this as unleashing potential in people more than anything else, and that should be a focus that we all have. Thank you very much.
Thank you, Minister, and just to assure you we will return to normal on Monday. And just to say that Joanne Sanson on your left, she was the pace setter for breaking the rules. So anyway, we'll say no more. She did give me warning out in the hall. Anyway, I just want to thank you all very much. To you, the members of the Disabled People's Parliament, that's how you wish to be described. And as we bring today's proceedings to a close, I want to express my sincere appreciation to everyone who took the time to share their experiences, their frustrations, their hopes, and indeed their ideas. The range of issues we explored, from healthcare, social security to education, independent living, transport, employment and housing, reflects the breadth of challenges facing deaf and disabled people across Northern Ireland, but it also reflects the depth of insight, expertise and determination that you have all brought into this chamber today. Your contributions have been very thoughtful, honest and impactful. They have challenged us all to think more clearly about the barriers that persist, and they have reminded us why inclusive decision making is not optional, it is essential. The personal testimonies delivered today are not simply commentaries on policy, they are lived realities that demand attention, they demand action and indeed accountability. So I want to thank the Minister for Health and the Minister for Communities for their engagement and their responses to this motion. Thanks also to the Minister for Infrastructure, who met with participants earlier today but was unable to stay for the Parliament. The attendance of executive ministers today sends an important message about the value that this Parliament and the importance of listening directly to the people who are most affected by the decisions that you take. My thanks also to members who joined us throughout today, particularly Kelly Armstrong and Donny Donnelly, to my right here, who have attended throughout today's proceedings and throughout this entire debate. My thanks also go to the organisers and to the individuals who co-designed this event through the consultative panel. Your commitment has ensured that this Parliament reflects the diversity and the complexity of the community it represents, that it remained firmly rooted in lived experience. And to everyone who participated, thank you for your leadership, for your courage and your generosity in sharing your experiences. It's not easy. I understand that the insights that you have provided today will form a report on the Parliament which will be shared with all executive ministers, all executive or all assembly committees, and indeed to all the MLAs. I hope that you leave today knowing that your voices and your views have been raised and highlighted in this chamber. I look forward to reading the Parliament's report and following its recommendations and their outcomes. This Parliament is important. It's an important reminder that policy is the strongest when shaped by those who live with its impact, and I hope that today contributes to a meaningful progress, stronger collaboration and a renewed commitment to removing barriers that limit opportunity and indeed equality. So thank you all once again for your time. Thank you all again for your honesty and indeed your contributions. So we now move formally to close our proceedings in the normal way through the adjournment. So the question is that the Disabled People's Parliament do now adjourn. The meeting is adjourned. Thank you.